And good afternoon. It is Friday, and today we're going to be talking about magnesium and how magnesium specifically works and helps you if you have fibromyalgia or if you have migraines. So we do have people that come into the clinic that have fibromyalgia, and that's a big, long word, but basically what that is, a diagnosis is unspecified muscle pain. Pretty much every muscle in your body hurts. You may think it's nerve pain. It may come across as nerve pain, but there's no, oh, I hurt my hip, and so therefore I have this. This is just a general condition, and basically what this report is saying is you have need of magnesium. So we're going to talk about magnesium. You only need, on your blood work, I think it's 2.2, I think it's nanogram per deciliter, but don't hold me to that because I may be wrong on that. But anyway, it's a very low amount that you need in your blood. But what we're going to find is that you may be competent in your blood work, but you don't have it in your tissues. Now, just as part of a disclaimer, I'm going to tell you some personal information that, I mean, if you know me, if you've seen me in the flesh, then you know. I was diagnosed about 6 years ago with bone-on-bone arthritis in my right hip. Now, I've seen the x-rays. The right hip and the left hip don't look any different really to me, but of course I'm not really educated in that. But what I will tell you is that the pain came from my muscles. And so one of the things that I have been doing over the years is I have been taking magnesium supplements because my body just moves that much better with the magnesium. Now, since February, March, and April, I was working with a physical therapist, and they did absolute miracles on my hip. I have been told by multiple practitioners that I was going to need hip replacement surgery, and that just didn't feel right to me. And I will tell you that I probably have regained 90% of my function, so I'm very thankful. Praise God for that. Very, very thankful. However, I do know that when I take magnesium, my muscles work just that much better. So magnesium is something that we all need, and apparently we are all pretty deficient in this. And so with the fibromyalgia that we were talking about, there's no visible injury. However, it is a very prevalent diagnosis because it has to do with chronic pain. In 2022, there was a clinical trial that tested magnesium as a potential treatment, and it was really easy to be skeptical because, after all, you don't need very much in your blood to be competent, right? So people were just like, well, we're testing this, but we really don't expect too much. However, I'm just saying that there are some statistics here on this clinical study, what they found. The study found for the first time that magnesium may help ease fibromyalgia symptoms, particularly with stress and pain. So if you are not feeling stress, you must live in a hole somewhere because the whole country is just going crazy. I don't care what side of the aisle you're on. Everybody thinks everything is crazy, and so that leads to a lot of stress. Stress depletes your magnesium stores. And stress depletes all of your mineral stores, okay? And so what we want to do is we want to know where we are, and we want to know that stress really does affect our magnesium. So the participants were randomly assigned either to take 100 milligrams per day of magnesium or to take a placebo. And they did this one tablet a day for 1 month. The study's primary goal was to assess whether magnesium could lower stress levels, since stress is often a trigger for fibromyalgia flare-ups. The researchers also tracked pain, sleep quality, fatigue, and overall well-being. So at the end of the month, the results were mixed. Overall stress levels tended downward in the magnesium group, but the results were not significant. However, on closer examination, they found something very, very interesting. Among the participants who started the study with mild to moderate stress, magnesium had made a clear difference. In that subgroup, the stress scores dropped significantly, while the placebo group saw absolutely no change. Pain severity also declined with the magnesium supplementation. It is a small but meaningful shift that suggests that the mineral might have a role in easing the fibromyalgia burden. In moderately stressed patients, pain scores dropped to 5.1 from 5.7 on a 10-point scale. So it's not a significant drop, but as someone who has suffered chronic pain, that would be me, any kind of drop is going to be significant. So on a scale of 1 to 10, they were almost at a 6, 5.7. After they had taken magnesium for 1 month, their pain level dropped down to 5.1, which is a small increase, but it is an increase nevertheless. I will tell you, last Saturday, I think we went out shoe shopping. I needed new shoes. And we're walking, and my husband's looking at me, and he says, "You're walking with a limp. Are you hurting today?" And it's like, yeah, I'm hurting today. And so at the end of the day, don't even ask me why, but at the end of the day, I was looking at my supplements, and I realized, oh my gosh, I didn't take the magnesium today. So I took the magnesium on Sunday, and there was a significant change in my gait because my muscles were doing much, much better. So I'm just telling you, as a human being that has suffered chronic pain for 6 years, at one point, the pain was 10 out of 10. Thank you, Jesus. For the last about 3 to 4 years, the pain has been very, very negligible, but I needed a cane to get around, and I had no stamina and all that kind of thing. Since working with the physical therapist, all that has changed, but I still need the magnesium in order for my muscles to work the way they need to. So the study found that sleep, fatigue, and overall quality of life remained largely unchanged between the two groups. But still, for the people who have grown tired of side effects and short-lived solutions, magnesium's gentle, low-risk benefits may be worth noting. Now, fibromyalgia and headaches are two of the main conditions for which magnesium's potential role is significant, all right? They're looking at pain relief. Now, years and years ago, I'm talking 40 years ago, I had really, really bad headaches, and thank you, Jesus, I don't have those anymore, so I'm very, very grateful for that. But we do have people that come in with chronic pain, chronic headaches, migraines, all that kind of thing. And so this study shows that magnesium could really help with that. So patients with fibromyalgia are often found to have lower magnesium levels in their blood, in their hair, and in their diet. Now, to check what your magnesium levels are in your hair, we have to send off your hair for a DNA analysis, or not a DNA analysis, but a mineral analysis. We do DNA analysis, okay? And I had a customer that wanted to talk about that this morning, so that's like top of mind for me. But magnesium levels are primarily tested through serum blood tests. This measures only a small fraction of the total magnesium in the body, and most magnesium is stored in your bones and in your tissues. It's important to note that normal serum levels do not rule out magnesium deficiencies. In some cases, a hair analysis or urine test can be used to assess magnesium status, although these are less common. So we do mineral analysis. So if you want to do that, we do that. So we do DNA and we do mineral analysis with your hair. So magnesium plays a pivotal role in the development and the progression of both migraines and tension-type headaches. While the exact cause of migraines remains unclear, magnesium is known to influence certain mechanisms, including neurotransmitter release, brain excitability, and blood clotting. Low magnesium levels have consistently been linked to migraines, which some studies suggest that supplementation may help reduce the frequency and the severity of the attacks. One study found that 80% of patients given 1 gram of intravenous magnesium were pain-free in 15 minutes. Now, if you're a fibromyalgia sufferer if you are a migraine sufferer and we can give you an IV of magnesium, wouldn't you want to do that if you could be pain-free in 15 minutes? We're not able to do that here in the clinic, but I do have partners that I can refer you to that do that, and they come to your home to do that. And so it's one of the easiest ways to get that IV magnesium if you need it. In some cases, supplementation has led to long-lasting improvement in people with tension headaches lasting up to a year or more. In one case-controlled study of 40 patients, magnesium infusions completely eliminated pain in 32 out of the 40 participants within 15 minutes. I would sign up for that in a heartbeat. I have lived with chronic pain. It is not fun. It wears you out. It makes you depressed. It destroys the quality of your life. It just destroys it. And so if you can have an IV magnesium infusion, now you wouldn't want to do this every day, but if you did it and you were pain-free in 15 minutes, I would be doing the hallelujah dance for sure. So magnesium is emerging as a potential solution to chronic pain. But how does it offer pain relief? So I'm going to get a little geeky on you here with this report. One of the ways is magnesium helps reduce the pain by blocking N-methyl D-aspartate. So the initials of that are NMDA. All right. These are receptors that play a crucial role in your nerve cell communication. While these receptors are important for learning and memory, the overactivation of NMDA receptors allows excessive calcium to enter into the nerve cells through these receptors, and magnesium helps to prevent the nervous system from becoming overly sensitive to pain. It offers relief from various painful conditions. Additionally, magnesium conserves the electrical potential of the nerve cells, further aiding in pain regulation. Now, I'm just going to do a little sidebar here. When you have nerves, we all have nerves. We all know we have nerves. I don't know if you've ever looked at what a nerve looks like, but we're going to pretend that my arm is a nerve and my fingers are dendrites. Okay, so you've got nerves and you've got dendrites, and the electrons or the electromagnetic charge passes from dendrite to dendrite. When you have viruses, the viruses actually live in your nerves and they cause your nerves to overfire. When they overfire, you burn the melanin sheath off of your nerves, which would be like, if we're using this as nerves, it would be burning the skin off of my nerves, the melanin sheath. And so when this happens, you are in absolute burning pain all of the time. And so magnesium stops that overfiring of the nerves. And so that's one way that it mitigates the pain. So we want to know that it mitigates both pain and inflammation. It is a foundational nutrient. Without it, other pain therapies often do not work as effectively. So magnesium's role in reducing pain could also be linked to its ability to regulate muscle constriction and protect cartilage from degradation. So Emma Lang is a registered dietitian nutritionist, and she has a doctorate in food and nutrition. And that's what she says about magnesium and muscle contractions. So I will tell you, as a human, right, not the doctor, but as a human, I know that when I take magnesium multiple times a day, that I have a much better time with my muscles. My muscles do not hurt as much. My muscles are more supple. They move better. My gait is better. All of that is very, very significant because you want your muscles to work the way they need to. And so if you're having any kind of muscular issue, then you're going to want to look at magnesium. I'm going to show you some various products in a minute, show you what I take and what I find that works the best for me. So oral and IV magnesium supplementation differ in how quickly and effectively they work. Oral supplements, typically pills or powders, are best for mild to moderate deficiencies or long-term maintenance, though they can cause digestive side effects such as diarrhea and are absorbed more slowly. On the other hand, IV magnesium is administered directly into the vein, and it is used for more urgent and severe cases such as eclampsia, arrhythmias, when the oral route doesn't seem to be a good option. It works quickly. It bypasses the gut, which is, you're not going to have those gut-related issues. However, IV administration needs medical supervision because of the risk of overdose, and it is not good for routine use. Okay, so I'm going to show you I've got some more things to tell you. I'm going to show you some different ways that you can find the magnesium. Now, remember, in this report, they gave you 100 milligrams of magnesium every day for a month. We have this magnesium. It's called magnesium hydroxide, and we've got 3A magnesium. These two are a different kind of magnesium that you would want to use if you have chronic constipation issues. You would not want to use these for muscular issues, okay? So this is what you would use for your chronic constipation. If you overdo these, you are going to have diarrhea and you're going to have GI upsets, and we don't want to do that. So it's really important what kind of magnesium you take. This is a really good magnesium, but it also has in it all of these herbs. So it's not just magnesium. When you're looking at this one, right, the only ingredient is magnesium, all right? I prefer this one because it has all the cofactors in that makes the magnesium easier to absorb. I've got another one, and I was going to tell you, this one has 90 milligrams of magnesium. This one has 100 milligrams of magnesium, but it doesn't have all of the cofactors. I've got another one that is specifically for your heart, because your heart is a muscle, right? And it's got 330 milligrams of magnesium, but it also has the cofactors with it. It's from the same vendor as this one. This one is better for sleep issues. The other one's better for cardiac issues. So if you have heart issues, that's a better magnesium. Now, this is the magnesium I use. It's called 3A. It's called Formula 303 is what it's called. I like this one because it is a homeopathic formula. All right. And so it's got in it valerian root, it's got in it passion flower, and it's got in it the magnesium. Me as a human, when I am under stress, my whole body just crunches, right? My shoulders get tight, my jaw gets tight, my hip gets tight, all those things happen. When I take this, and I try and take it at the first instance of me feeling tight, when I take this in 20 minutes, my whole body just relaxes. So I like this because you don't have the diarrhea issue. You don't have any of those other issues, the GI issues, the diarrhea and whatnot. You don't have that with this. Plus, the valerian root also is a relaxer. And so this is the one that I do, and there's no side effects. It's just amazing. And so, we've got a lot of things for you to look at, and there's a lot of different types of magnesium. And so you don't want to get the ones that give you diarrhea because that's not what you're looking for. You're looking for muscle relaxants. So magnesium's effectiveness in managing pain depends not only on its mechanisms, but also the form of which it is taken. Magnesium glycinate, that's the one that we have that I didn't show you because we're all sold out. Okay, that magnesium glycinate is well absorbed. It has a calming effect, and it is very, very good for muscle tension. Okay, I use it primarily for heart issues. Okay, however, it's also very good for fibromyalgia. There's another magnesium called topical magnesium chloride, and this is what you find in your Epsom salts. And this is excellent for targeted relief with pain. So there are magnesium topical lotions. I have never used one. When I was back in the 10 out of 10 pain, I would use a CBD lotion that had CBD in it, and it had some menthol in it and just different things. I can't remember exactly what it had in it, but it was a little pump, and you would pump it, and I'd put it on my hip where the pain was, and within 20 minutes, the pain was gone. So I have never used a magnesium lotion because I've got that CBD lotion that I absolutely love, and I'm never without it because you just don't know when you're going to need it. But that's what I use for topical pain. Oral magnesium threonate is particularly beneficial for neuroinflammation, brain-based pain, such as migraines, because it can cross the blood-brain barrier. So, how do you get magnesium in your diet? Well, it's pretty easy, actually. It's pretty easy. You can consume any of these foods: pumpkin seeds, leafy greens, avocados, cashews, dark chocolate, and bananas. So, pumpkin seeds are also good if you are a man and you have prostate issues. Pumpkin seeds are good for that. Pumpkin seeds are also anti-parasitic, so they're good for that. But they also have magnesium in them, and if you use them in your diet, then and you can just eat them by the handful too. You can do that. Leafy greens, of course, nobody likes greens. I know some people do, but most people don't like leafy greens. I personally am not much on the mustard greens and the collard greens and all that kind of stuff. I'm not much on those, but I take, and I don't have it on my desk right now to show you, but I take vitamins that are made from greens so that I get all the greens that I need in my vitamins. Avocados, who doesn't love guacamole salad, right? Who doesn't love avocados on toast? Me, I love that. I love all that. Avocados are good fats, and they're good for your brain. They also have a lot of magnesium. Also cashews. Now I want to caution you with cashews. Cashews have a lot of calories as well. I love them. They taste good, and I could eat a whole jar in one sitting. However, they're very, very high in calories or high in fat, and so you might want to just, pay attention to that. Dark chocolate has a lot of magnesium in it, and this is why women, when they are on their monthly cycle, they crave chocolate. Why? Because they're cramping. Their muscles are cramping, and they know intuitively, the body knows chocolate has magnesium in it, and that's why when we are quote unquote hormonal, we're reaching for that chocolate because it's got that magnesium in it, and that's going to help with the muscle contractions. Bananas, I normally look to for potassium, but it does have magnesium in it too. So one of the things that you could do with the pumpkin seeds is to put it on your breakfast. So if you have oatmeal for breakfast or you have the avocado toast, then you can put the pumpkin seeds on that. You can incorporate your greens on your lunch and your dinner. I know some people that do their greens with their eggs too. So you can do it any way you want to, as long as you get them in you. Most people eat the SAD diet, Standard American Diet, SAD, right? And it is sad because most of the people have processed foods. They don't have the foods that they need in order to have the nutrients that they have. And this is why I take as well as good foods. I eat cashews, I eat greens. I don't necessarily eat a whole lot of pumpkin seeds. I have in the past, but they're not part of my constituent right now. I do the dark chocolate, and I like the dark chocolate. It only takes one little square, okay? My husband buys me the Dove chocolates, right? And it's the dark chocolate, and one little square is so rich. I've had the you know what I'm trying to say, Gardnerelli. That's not right, but you know what I'm talking about. Those dark chocolates that are absolutely delicious, but you only need one square because they're so rich. Now, you don't want to do the white chocolate. You don't want to do the milk chocolate. There's too much sugar in there. But the dark chocolate has that magnesium that you're needing, that your body's needing. So it typically takes 2 to 4 weeks of consistent dietary intake or supplementation to notice change in chronic pain. And I just want to say, if you do Formula 303, you will have pain relief in 15 to 20 minutes. I'm telling you that. I live it. I know. And so it works on a different vibrational frequency. This one is a nutrient. This one is a nutrient. These are for chronic constipation, right? You don't want to do too much of these. But this is homeopathic. It works at a higher level. And like I say, the results are within 15 to 20 minutes. So I'm excited about that because nobody wants to be walking around in pain, okay? Pain is part of living. I understand that. But if you can do something to mitigate that, then you can have a much better quality of life. So the type of magnesium matters. If you get one with all the cofactors, like this one, it's got all those ingredients in it, it's going to be much better than something like this that just has magnesium. So your body gets your minerals from your food. They don't come separated. They come combined. And so this is why I like to work with vendors that have all the cofactors in there so we know that we're not just missing out on different things, okay? Tissue magnesium levels in the body can be low even when blood levels appear to be normal. Now, there is a caution if you take prescription medicines. There are some prescription medicines that interact with magnesium. So you need to make sure that you talk to your doctor and make sure that you're not having any kind of counterindications with that. Magnesium supplements can interfere with medications. Magnesium may reduce the effectiveness of certain blood pressure medications, such as calcium channel blockers and diuretics. These can either lower or increase magnesium levels in the body. Additionally, taking magnesium alongside supplements such as calcium or vitamin D may require an adjustment in dosage. So that's why it's important to talk to a healthcare professional so you know what you're doing. We have a vitamin D K product that you spray right into your cheek. You just put it in your mouth and you spray. It goes right into the bloodstream. It doesn't go through digestion, so your magnesium is not going to interfere with that. And so this is why when you have really high quality products, you are getting different delivery mechanisms. The vitamin DK is a liposomal product. It goes right into the mucous membrane in my cheek, right into the bloodstream, bypasses digestion. So when I take this, it dissolves, it's quick dissolving, it dissolves, and like I say, I have pain relief in 15 to 20 minutes. So if you are suffering from fibromyalgia, if you have chronic muscle pain, if you have tension, headaches, or migraines, and you might want to think about supplementing with magnesium and see if that helps you. Remember, if you just do magnesium by itself, it's going to take 2 weeks to 4 weeks before you're going to see any change. And the change is honestly not that drastic. If you do something like this, which is homeopathic, then you're going to get a really quick response. Now, one dose, I take 3. One dose is not going to get me through the day. It'll get me through probably 3 or 4 hours, then I'll need to take another dose. But it's worth it to me to stay pain-free and to have my muscles not be tense. So this is what my findings are. This is what you're going to find too. So if you need any help in this, let me know. I hope you have gained some information about managing chronic pain. Chronic pain comes in all kinds of different forms. And so that's what we want to do. We want to manage it. We want to dissipate it. We don't want to live in chronic pain. That's no way to live. So it is a weekend. Pray for me. I'm on my way to Lufkin tomorrow to see clients in Lufkin. And so it's going to be a good day. It's going to be a day that is just full of promise for people that have chronic pain. All right. And take time to refresh, to rejuvenate, all right, to rest, to do those things that bring joy and life joy and light to your life. And I will talk to you next week. Thank you for commenting, liking, sharing, all the things.